Community healthcare workers go into villages, into communities, measure basic parameters, your blood pressure, your blood glucose, your cholesterol. Normally, they will then go back to the clinic on a Friday after having taken this data for 4 days. The reality is, if a patient on Monday had a blood pressure that was extremely high, by Friday, by the time the community healthcare worker reports it to the clinic, that patient could have had a stroke or could have passed away.
We're gonna do your blood pressure test now.
Put the cuff at the same level as your heart. Don't move and keep quiet.
The Mhealth solution is to have a web-based system whereby through any of the mobile devices, whether it's phones, whether it's tablets, as you take the blood pressure, you use Bluetooth-enabled devices that can transmit the data real-time through the mobile devices to the web-based solution, which already has parameters. If the blood pressure, as an example, is too high, then there will be a signal sent to that mobile device to say either repeat that reading or send that patient to the nearest hospital or clinic. Therefore, it gives the community health care worker power now to be able to assist these patients in real time as they visit them in the villages.
Your pulse is 80 pulse per minute. According to the World Health Organization standard, your blood pressure level is normal.
The system can measure blood pressure, blood glucose, cholesterol, temperature, and we can even add an ECG, but because of community healthcare workers who are not medically trained, we exclude the ECG in the system. The system is almost 99% accurate. We have done a lot of research with the CSIR to ensure that the quality of the system is appropriate for healthcare. We would like to see in the whole country and in other parts of the continent, patients being monitored in real time in the villages so that we don't have this disparity of rural population not getting appropriate healthcare. We believe that we can improve the quality of life of patients in rural areas, but also we can save the state massive amount of money that is spent on communicable diseases that are not controlled. This is a South Africa first innovation done by us, homegrown, and I believe that there's a lot of export potential for some of these products and they can bring a lot to the economy of our country.